Sawadee and good afternoon once again. First of all, I have to begin with Merry Christmas. It's Christmas Eve today. Hopefully we're celebrating Christmas tomorrow around the world in a very safe, in a very health conscious manner. Of course, here in Thailand, the measures remain very, very important, and we have to remain very, very stringent in our enforcement of the measures. Now, Dr. Apisamai in the Thai language version just now talked about one important issue is about New Year's. Of course, New Year's is just around the corner. Christmas is tomorrow. Christmas Day is tomorrow, and New Year's is just around the corner. Now, there are 5 provinces wherein the Ccsa had permitted the New Year celebration countdown activities to be exact. These provinces include Phuket and Rayong, just as an example. Now, these New Year countdown celebrations in the province of Phuket, for example, which is a sandbox province, will be held under very, very strict circumstances with very strict procedures. For example, people who attend the countdown event in Phuket, the countdown events in Phuket, would have to be fully vaccinated, meaning vaccinated twice. And of course, all participants being tested with ATK before joining in the countdown activity. Now, these are the activities which were approved by the Ccsa in 5 provinces around the country under very, very strict rules. So this summary today is for Friday, the 24th of December. Today, Christmas Eve. Hoping that you all will continue with the various measures, keeping your guard up despite the various alarming news or information that we receive from time to time around the world. So I'd just like to first recap on the Ccsa daily meeting this morning that we had this morning. And as usual, the Ccsa meeting this morning reviewed the global situation and of course the situation in Thailand. At the global level, the number of new cases has clearly surged, and with more than 900,000 cases reported worldwide during the past 24 hours. The highest number of cases was reported in the United States, followed by the United Kingdom. Both reported new cases in the 100,000s. Now, Omicron has now been detected in at least 98 countries around the world already, and I believe more than 98 already. Thailand, here in Thailand, we're still in the 24th place compared to other countries around the world. 24th place. For the number of cases, I'll go into more details on the situation later on. The Ccsa meeting this morning also discussed about research on vaccines. And please to note the results of research which found that a mRNA booster dose is effective in protecting the elderly from the Omicron variant, and that an AstraZeneca booster dose similarly provides effective protection against Omicron. More on COVID research, pending peer review, is that the hospitalization rate from the Omicron variant thus far is less than of the Delta variant. However, as alerted by Dr. Apisamai just now in the Thai language briefing, there is no reason for all of us in society to let our guard down. Medical personnel are still remain consistently exposed to the virus, and the general public's immunity is also changing. I'll touch a bit on the screening procedure for travelers in Thailand, which was mentioned by Dr. Apisamai. And on this issue, I think we'll be having around 2 slides coming up for you. Dr. Apisamai mentioned about the screening procedures for travelers in Thailand. Now, upon arrival, travelers would be given a form which we'll call the Port Health Letter. They'll be given the Port Health Letter at the airport, which will be signed at the border control by the border control officer and certified by the Department of Disease Control. The border control officer will then give travelers a copy of the port health letter and a QR code stating the venue for the second COVID-19 test at no additional cost. And now we have on screen for you there the QR code of the designated lab centers for that second RT-PCR at no additional cost. So this letter designated designated lab centers for the RT-PCR is for day 5 and day 6 after entry into Thailand, which is free of charge. So the form at the airport and the locations you can find on this QR code. But of course, upon arrival, there will be those instructions available. I believe we may have another infographic photo of the actual port health letter as well. Now, so continuing on this screening procedure, once you arrive in Thailand and arrive at the hotel, you would present this port health letter form at the hotel. Now, this is some samples of that port health letter on screen. Yes, on screen for you there. Now, when you arrive at the hotel will then key in your record onto the COST platform. So the COST platform stands for the COVID Surveillance, Tracking and Evaluation Platform, COSTE, C-O-S-T-E platform. The hotel will key in that information in this internal platform and arrange for your first COVID-19 test. Now the hotel will ask for your information about the accommodation on your day 5 to day 6, in case you transfer or you move hotels, in order to record onto the COSTE platform. And on day 5 and 6, take your port health letter to the designated lab centers for your second COVID-19 RT-PCR test with no extra cost. I'll move on to the New Year festivities, as I touched upon briefly just now at the outset. The Ccsa today also discussed about this issue, a very important issue. You may have seen also in the news this morning that festivities are allowed to take place under conditions, although the Bangkok Metropolitan Administration has cancelled its own events due to public health safety. The private sector is allowed to host New Year festivities, but will have to strictly enforce disease control guidelines, obviously. This includes wearing masks, negative ATK results for participants, registration and temperature checks. The meeting this morning also discussed public health precautions for New Year festivities in various parts of the country to ensure that they are up to standard. The Ccsa understands that this is holiday season, it's Christmas and New Year season, and that everyone would like to celebrate with family and friends. However, please continue to practice universal precaution for your own safety and the safety of your loved ones as we prepare for what will hopefully be a better New Year for all of us. Now I'll move on to the regular updates that we have for you. As usual, we continue to monitor the number of incoming travelers and trends in imported cases. So as of 9 a.m. this morning, today 9 a.m., we have logged a total of over 700,000 applications on the Thailand Pass system for entry into Thailand. So during the 1st to the 23rd of December, a total of 205,568 travelers entered Thailand. And of this number, over 176,000 travelers entered via the test and go or the quarantine exemption scheme. Of course, this is for those who have applied and been approved prior to the pause of the system that we had a few days ago. Now, over 24,000 travelers entered via the sandbox scheme and 984 travelers via the 7-day quarantine, 2,995 via the 10-day quarantine, and 459 entered via the 14-day quarantine. Now, I talked about the quarantine days. Just to clarify on that issue, and there were some inquiries regarding the number of days, the current number of days in which quarantine would apply. Now, there's this infographic for you on screen there, which we received the source from the Tourism Authority of Thailand. So firstly, the 7-day quarantine applies to travelers who have a certificate of vaccination to confirm that they have been fully vaccinated with an approved vaccine for at least 14 days before traveling to Thailand. 10 days would mean quarantine applying for travelers who do not have a certificate of vaccination. And 14 days quarantine applies to travelers from the listed countries in Africa other than the previously designated high-risk countries, which are constantly being reviewed. And we had that announcement earlier. So moving on to the top 10 countries of origin for entry into Thailand: Germany, UK, US, Russia, France, and the rest, as you see on screen. Out of the total number of travelers, we found that 525 tested positive for COVID-19, or 0.26%, which is relatively low. And this reflects, of course, the strong strong disease screening procedures that are put in place. As for vaccination progress within the country, yesterday we administered over 530,000 doses of vaccines, increasing the accumulated number of vaccinations to over 101.6 million doses. And as of yesterday, the 23rd of December, 70.6% of the population in Thailand have received their first dose, and 62.5% have received their second dose. Given that Thailand has now administered more than 100 million doses of vaccines and that more than 70% of the population have now received at least one dose, Thailand is now in a better position to help others and has already started with certain preparations. Now, just an additional information is that within the country, as you have always mentioned, we don't distinguish between Thai nationals and non-Thai nationals, foreign nationals, in our national vaccination campaign, in our national drive to inoculate everybody in the country. Also, we have administered vaccines to many vulnerable groups as well, including migrant labor, migrant workers in the fishing sector, so migrant labor in the fishing sector and other important sectors as well. This is, of course, for both Thai nationals and non-Thai nationals. Now, at the beginning of this month, Thailand expressed the interest in joining the African Vaccine Acquisition Trust, or AVAT. Now, this is, of course, solid proof that we're in a better position to help others and help other countries around the world in terms of our international cooperation. So we expressed interest in joining the AVAT to donate vaccines to the African continent. We, of course, stand ready and are in solidarity with other countries in combating the virus and, of course, living by the principle that no one is safe until everybody is safe. And you have a picture there of the Minister of Public Health with the Director General of the World Health Organization in their meeting, in the discussion about joining the African Vaccine Acquisition Trust, or AVAT. Now, within the country itself, within our country, in the general situation and numbers that we have for today, new confirmed case, you see on screen on the left bottom blue box, 2,671. Compared to new recoveries we recorded for today, which is 2,766. We have active cases still being treated in hospitals and centers, which is 38,192. This number continues to decline as the day goes by. As the days, we see days ahead, we'll be having less and less active cases. Hopefully that will be the trend, the continuous trend that we have. We have, unfortunately, 27 new fatalities The new fatalities today, we have 21, which are from the elderly group, and 4 with underlying health conditions, and the remaining 15 were those who were unvaccinated. Now, the average daily number of cases over the past week, the average mean is over 2,800 of daily cases in terms of a weekly average. This is a good sign that we are now going down to 2,000 plus per day, compared to the previous months, which we had 3,000 to 4,000 plus cases per day. In terms of Omicron, the latest information is that we in Thailand here have now detected 205 cases of Omicron in Thailand. And the majority is, of course, from imported cases, those traveling into Thailand, which is what we expected from the World Health Organization's report on the doubling rate within a few days. Now, talking about Omicron, we have to look back at the other variants as well, Delta, for example. So in comparison, actually Delta is, however, it still remains the dominant variant in Thailand. So Delta is the dominant in Thailand despite the threat of Omicron. And of course, we continue to encourage everyone to get vaccinated as soon as possible. And on screen now, we'll be having the top 10 provinces with the COVID-19 cases. In green, of course, less than the previous day, and numbers in red, more than the previous day. Top 5, Bangkok, Chonburi, Nakhon,ศรี Thammarat, Samut Prakan, and Songkhla provinces. It's quite good to see that most of the top 10 provinces are showing numbers in green, having less reported cases than the previous day, and hoping that this downward trend will continue in Thailand. So just in closing, I'd just like to share some information on free ATK testing for 4 risk groups as we work to control the spread of COVID-19 around the clock. The 4 risk groups, including the elderly, those who are suspected of being infected, close contacts of confirmed cases, and people working in community health care. Now, free ATK testing is available via the drive-through service here in Bangkok, at the Bangkok bus terminal on Boromarachathonani Road or Sai Tai Mai, and 11 hospitals affiliated with the Bangkok Metropolitan Administration, or BMA, as shown on screen. So you can see that on screen. It's in the social media as well of the PRD, or Public Relations Department. So with that note, I hope you have a very safe and COVID-19 free holiday. I hope you have a very happy Christmas, and of course next week, New Year holiday. Please continue to keep your guard up, stay healthy and stay strong, and don't forget to take the ATK test regularly. The best wishes and best of health to everyone, and have a very, very happy weekend. Thank you, and สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐพันธ์